desired high. In behavioral addictions, risks may include reckless gambling with life savings or neglecting health due to sedentary, screen-immersed lifestyles. These actions are often impulsive, poorly thought out, and driven by compulsion rather than rational consideration. Another symptom that frequently accompanies addiction is the development or worsening of mental health conditions. Depression, anxiety, mood swings, paranoia, and irritability are common in addicted individuals. These symptoms can either predate the addiction or emerge as a consequence of it. Often, individuals with underlying psychological conditions use substances or behaviors as a form of self-medication, which ultimately worsens the original condition and complicates treatment. This bidirectional relationship between addiction and mental health necessitates integrated care strategies that address both simultaneously. Denial and minimization are also characteristic features of addiction. Individuals often underreport or rationalize their use or behaviors, claiming they are in control or that others are exaggerating the problem. This psychological defense mechanism serves to protect the individual from confronting the severity of the addiction and the associated consequences. Denial can be a major barrier to seeking help, making family support and professional intervention critically important in the early stages of treatment. Physical signs of addiction can include significant weight changes, poor hygiene, disrupted sleep patterns, bloodshot eyes, frequent nosebleeds from snorting drugs, tremors, and unexplained injuries or bruises. Behavioral signs may include secrecy, lying, financial troubles, theft, and mood instability. The combination of physical, emotional, and behavioral symptoms often creates a noticeable change in the individual's overall functioning and demeanor. In summary, addiction is characterized by a constellation of signs and symptoms that span across physical health, mental well-being, and behavior. Craving, loss of control, tolerance, withdrawal, continued use despite harm, neglect of responsibilities, risky behavior, and psychological distress are all key indicators. The recognition of these symptoms by healthcare providers, family members, and the individuals themselves is critical for timely diagnosis, intervention, and the initiation of appropriate treatment. A comprehensive understanding of these manifestations not only facilitates better clinical care, but also fosters empathy and reduces stigma toward those struggling with this complex and chronic condition. Addiction is a multifactorial condition, meaning it arises from a complex interplay of biological, psychological, and environmental influences. No single cause can be pinpointed as responsible for addiction. Rather, a combination of vulnerabilities and exposures increase the likelihood that an individual may develop this chronic and relapsing disorder. Understanding the causes and risk factors of addiction is essential for prevention, early identification, and the design of effective, personalized treatment strategies. These factors not only explain how addiction develops, but also why some individuals become addicted, while others in similar circumstances do not. Genetics play a significant role in the predisposition to addiction. Numerous studies, including those involving twins, adopted children, and family histories, have consistently demonstrated that addiction tends to run in families. The heritability of substance use disorders has been estimated to be around 40 to 60%, depending on the substance. Specific gene variants have been linked to addiction vulnerability, particularly those involved in neurotransmitter systems such as dopamine, serotonin, glutamate, and opioid receptors. For example, individuals with certain alleles of the DRD2 gene, which codes for dopamine receptors, may have a higher sensitivity to reward or a lower natural dopamine response, leading them to seek external sources of pleasure or stimulation. While genetics cannot predict with certainty who will become addicted, they create a predisposition that may be triggered or mitigated by environmental factors. Environmental influences are another major contributor to the development of addiction. These factors are often most impactful during childhood and adolescence, critical periods of brain development and psychological formation. Growing up in a home where substance use is normalized, witnessing domestic violence, experiencing neglect or abuse, and lacking parental supervision all elevate the risk of later addiction. Peer pressure and social modeling also play a significant role, especially among adolescents who may engage in substance use or risky behaviors to gain acceptance or cope with social stress. Schools, neighborhoods, and communities that are impoverished or have limited access to mental health resources and recreational outlets often expose individuals to higher levels of stress and fewer protective factors, further increasing the likelihood of addiction. Psychological and emotional factors are equally important in understanding addiction. Many individuals who develop addictive behaviors have underlying mental health disorders such as depression, anxiety, bipolar disorder, post-traumatic stress disorder, PTSD, attention deficit/hyperactivity disorder, ADHD, or personality disorders. The relationship between mental illness and addiction is bidirectional. Mental illness may predispose a person to addiction as a form of self-medication, and addiction itself can worsen or trigger mental health conditions. For example, someone with social anxiety may begin drinking alcohol to ease their discomfort in social situations. But over time, the alcohol use becomes compulsive and creates new psychological and physiological dependencies. Emotional dysregulation, low self-esteem, trauma history, and difficulties in coping with stress are psychological vulnerabilities that often contribute to the development and persistence of addiction. Trauma, particularly early life trauma, is a well-documented risk factor for addiction. Childhood physical, emotional, or sexual abuse, exposure to violence, and the death or loss of a parent can profoundly affect a child's neurodevelopment and stress response system. These experiences often leave lasting imprints on the brain's architecture, particularly in areas responsible for emotion regulation, impulse control, and reward processing. As a result, individuals with trauma histories may seek substances or behaviors that provide temporary relief or escape from emotional pain. In clinical practice, a trauma-informed approach to addiction treatment is increasingly recognized as essential, as untreated trauma frequently leads to relapse or poor treatment outcomes. Social and cultural factors also influence the development of addiction. Cultural attitudes toward drugs, alcohol, and behaviors such as gambling or technology use can determine whether these activities are seen as acceptable, risky, or stigmatized. In societies where heavy drinking is normalized or even celebrated, individuals may not recognize early signs of addiction or may delay seeking help due to fear of judgment. On the other hand, excessive stigmatization of addiction may lead to secrecy, shame, and reluctance to access treatment. Additionally, socioeconomic status plays a considerable role. Individuals in lower income brackets may face chronic stress, unemployment, homelessness, or lack of education, all of which increase the likelihood of turning to substances or behaviors as coping mechanisms. The availability and accessibility of addictive substances and behaviors are key external factors that affect addiction risk. Easy access to alcohol, tobacco, prescription medications, illicit drugs, and even digital platforms can significantly increase the likelihood of misuse and eventual dependency. For instance, the widespread prescription of opioids for pain management contributed to a public health crisis in many countries due to their addictive potential and availability. Similarly, the rise of smartphones and internet technology has led to an increase in behavioral addictions such as gaming disorder, pornography addiction, and compulsive social media use. When potentially addictive substances or activities are readily accessible and socially reinforced, the threshold for addiction may be lowered. Biological factors beyond genetics also contribute to addiction vulnerability. Differences in brain chemistry, neurodevelopment, and hormonal regulation can make some individuals more sensitive to the effects of certain substances or behaviors. For example, people with a naturally underactive dopamine system may be more prone to seeking stimulation through external means. Hormonal fluctuations, particularly during adolescence or due to stress, can also influence the brain's reward system and susceptibility to addictive behaviors. Neurological conditions such as traumatic brain injury, particularly when it involves the frontal lobes, can impair impulse control and increase addiction risk. Furthermore, sex differences exist in addiction vulnerability. For instance, although men are more likely to engage in risky substance use, women often progress more rapidly from use to addiction and may experience more severe withdrawal symptoms. Developmental timing is another important consideration. The earlier an individual is exposed to addictive substances or behaviors, the greater the risk of long-term addiction. This is largely due to the fact that the brain, particularly the prefrontal cortex involved in judgment and self-regulation, continues to develop into the mid-20s. Early use can disrupt this development, alter neural connectivity, and establish addictive patterns before cognitive maturity is reached. Adolescents are also more prone to impulsive decision-making and peer influence, making early intervention crucial in this population. Another risk factor includes the presence of chronic pain or physical illness. Individuals who suffer from persistent pain may begin using opioids or other medications to manage their condition. Without proper monitoring, this use can evolve into dependence and addiction, particularly if psychological support is lacking. In some cases, physical illness itself can lead to emotional distress and social isolation, which in turn increases vulnerability to substance misuse as a coping mechanism. In summary, addiction arises from a dynamic interaction between genetic, biological, psychological, and environmental factors. Genetic predisposition, early life experiences, mental health conditions, trauma exposure, social and cultural influences, and accessibility of addictive substances all contribute to an individual's overall risk. Recognizing these diverse factors is essential not only for preventing addiction, but also for designing treatment approaches that address the unique circumstances of each patient. A one-size-fits-all model is rarely effective in treating addiction. Instead, a comprehensive biopsychosocial framework is needed to understand and combat this deeply rooted disorder. In closing, addiction is not just a habit. It is a serious and complex medical condition that affects the brain, body, and behavior. Whether it involves substances like drugs and alcohol, or behaviors like gaming, pornography, or social media, the core issue remains the same: a loss of control, a disruption of life's balance, and a cycle that becomes increasingly difficult to break without help. Addiction affects people of all ages, backgrounds, and lifestyles. It steals time, health, relationships, and self-worth. But addiction is also treatable. With the right understanding, early intervention, and ongoing support, recovery is possible. As doctors, educators, and as a society, we must replace shame with science, judgment with compassion, and silence with open conversation in brain structure and function. The amygdala and hippocampus also play crucial roles in the neurobiology of addiction. These regions are responsible for emotional learning and memory. During the development of addiction, the brain forms strong associations between the drug or behavior and the environment in which it occurs. For example, a smoker may associate a specific place, time, or even mood with cigarette use. These associations become deeply encoded, making relapse more likely when individuals are exposed to such cues, even after long periods of abstinence. This phenomenon is referred to as conditioned cue reactivity and is a powerful driver of relapse, especially in the early stages of recovery. Stress systems in the brain also contribute significantly to addiction. The extended amygdala is involved in negative emotional states such as anxiety, dysphoria, and irritability. As addiction progresses, the individual moves from using the substance or behavior to seek pleasure to using it to avoid discomfort and emotional pain. This is described as the transition from positive reinforcement, seeking pleasure, to negative reinforcement, avoiding pain. The neurochemical changes that accompany this shift involve not just dopamine, but also other neurotransmitters such as corticotropin, releasing factors CRF, norepinephrine, and dynorphin, which are involved in stress and negative affect. These changes reinforce compulsive use and make withdrawal states particularly difficult to endure. Another layer of complexity in addiction neurobiology involves the role of glutamate, the brain's primary excitatory neurotransmitter. Glutamate is involved in learning and memory, particularly in encoding the associations between drug use and environmental cues. Chronic drug use disrupts glutamatergic signaling in the prefrontal cortex and its connections to the nucleus accumbens, further impairing decision-making and self-regulation. This disruption plays a critical role in craving and relapse, particularly when individuals are exposed to high-risk environments or emotional stressors. Genetics also influence the neurobiological vulnerability to addiction. Studies involving twins, family histories, and geno-wide association studies GWAS have shown that addiction has a heritable component. Specific gene variants affect how individuals metabolize drugs, respond to stress, or regulate dopamine and other neurotransmitter systems. For instance, variations in the DRD2 gene, which encodes the D2 dopamine receptor, have been associated with a higher risk of addiction. Similarly, polymorphisms in genes regulating opioid receptors, serotonin pathways, and stress response mechanisms contribute to individual susceptibility. These genetic predispositions, when combined with environmental factors such as early exposure to substances, trauma, or family dysfunction, significantly elevate the risk of developing an addiction. Furthermore, recent research has explored the concept of neuroinflammation in the context of addiction. Chronic substance use can activate microglia, the brain's immune cells, leading to a pro-inflammatory state. This inflammation contributes to neurotoxicity, cognitive decline, and emotional dysregulation. Targeting neuroinflammation is an emerging area of interest in addiction treatment, with studies investigating the potential of anti-inflammatory agents to support recovery and prevent relapse. Recovery from addiction involves a gradual reversal or compensation for these neurobiological changes. While some structural and functional abnormalities may persist for months or years, evidence shows that with sustained abstinence, many brain functions can partially recover. Functional MRI studies have demonstrated that brain regions associated with executive function, emotion regulation, and impulse control begin to normalize with time, especially when supported by behavioral therapies, pharmacological interventions, and social support. Understanding the neurobiology of addiction provides a crucial framework for developing effective treatment strategies. Medications such as methadone, buprenorphine, and naltrexone work by targeting specific receptors involved in addiction, reducing cravings and withdrawal symptoms. Similarly, behavioral therapies like cognitive behavioral therapy, CBT, and contingency management focus on reshaping thought patterns and behavior by leveraging the brain's plasticity. Advances in neuroimaging, pharmacogenomics, and brain stimulation techniques are opening new frontiers in personalized addiction medicine, allowing clinicians to tailor interventions based on an individual's neurobiological profile. In conclusion, addiction is a brain disease characterized by profound changes in neural circuits that govern reward, motivation, memory, and control. These changes are not merely the result of repeated bad choices, but are rooted in complex neurochemical and structural alterations that drive compulsive behavior, impaired judgment, and loss of control. The deeper our understanding of these neurobiological processes, the better equipped we are to offer effective, compassionate, and science-based care to those affected by this deeply challenging condition. Addiction is a multifaceted disorder that manifests through a variety of physical, psychological, emotional, and behavioral signs and symptoms. Recognizing these symptoms is essential for early detection, clinical diagnosis, and the initiation of appropriate interventions. Addiction does not always present uniformly. Its expression varies according to the type of substance or behavior involved, the individual's biological and psychological makeup, environmental influences, and the duration and severity of use. However, several hallmark signs consistently emerge in clinical settings, helping physicians and mental health professionals identify addiction regardless of its form. One of the most defining features of addiction is the presence of intense cravings. These cravings are powerful and overwhelming urges to use a substance or engage in a behavior, often occurring even when the individual consciously wishes to stop. Cravings are typically triggered by environmental cues, emotional states, or physiological withdrawal symptoms. They are a direct result of changes in the brain's reward and memory circuits, and represent a core component of both substance and behavioral addictions. When cravings become frequent and uncontrollable, they strongly indicate that the individual has transitioned from casual use or engagement to an addictive state. Another central symptom is the loss of control over use or behavior. This refers to the inability to regulate the frequency, duration, or quantity of substance use or behavioral engagement. A person may start with the intention to have just one drink, smoke one cigarette, or gamble for a short time, but repeatedly ends up exceeding those limits. This impaired control is not simply a matter of weak willpower. Rather, it reflects disrupted brain mechanisms responsible for decision-making and impulse regulation. Repeated attempts to cut down or quit often fail, despite a genuine desire to stop. This failure reinforces the psychological dependency and often leads to feelings of guilt, shame, and helplessness. Tolerance is another key physiological symptom of addiction. It occurs when an individual requires increasingly larger amounts of the substance or more intense behavioral stimulation to achieve the same effect. Tolerance develops due to the brain's adaptation to continuous exposure, which dulls the response of the reward system. For instance, someone addicted to opioids may start with a low dose for pain relief, but gradually needs higher doses to experience the same level of relief or euphoria. In behavioral addictions, tolerance might present as the need to engage in riskier gambling, more extreme sexual behavior, or longer gaming sessions to attain previous levels of satisfaction. Closely linked to tolerance is the phenomenon of withdrawal. When an addicted individual reduces or discontinues the substance or behavior, they often experience a range of unpleasant physical and psychological symptoms. Withdrawal symptoms vary depending on the addiction type, but can include anxiety, depression, irritability, tremors, sweating, nausea, headaches, insomnia, fatigue, and in severe cases, seizures or hallucinations. These symptoms occur because the body has adapted to the presence of the substance or behavior, and its sudden absence causes a physiological imbalance. Withdrawal is one of the major barriers to recovery, as individuals often return to use to avoid these distressing experiences. Continued use despite negative consequences is another hallmark symptom of addiction. Individuals often persist in their behavior even when they are fully aware of its detrimental effects on their health, relationships, finances, or legal status. A person may keep drinking alcohol despite developing liver disease, continue smoking despite chronic bronchitis, or keep gambling despite accumulating debt and family conflict. This persistent engagement is not due to ignorance or denial alone, but is driven by compulsive patterns deeply embedded in the brain's reward, stress, and control systems. In many cases, individuals express remorse or acknowledge the damage caused, yet feel powerless to stop. Neglect of personal responsibilities and social obligations is another clear behavioral sign. Addiction often leads individuals to abandon their duties at work, school, or home. Productivity may decline, deadlines may be missed, and performance may suffer due to preoccupation with the addictive substance or behavior. Relationships with family, friends, and colleagues are frequently strained or broken, as the addicted person prioritizes the addiction over interpersonal commitments. Social withdrawal is common, as individuals either isolate themselves to hide their behavior or associate only with others who enable their addiction. Another significant symptom is the disproportionate amount of time spent in activities related to the addiction. This includes time spent obtaining the substance, using it, recovering from its effects, or engaging in preparatory rituals. For example, someone addicted to cocaine may spend hours planning, acquiring, and using the drug, followed by long periods of physical recovery. Similarly, a person with a behavioral addiction such as gaming may sacrifice meals, sleep, or personal hygiene due to extended sessions. Over time, other interests and activities that were once enjoyable or fulfilling are neglected or abandoned. Risky or hazardous behavior is frequently observed in individuals with addiction. This may involve driving under the influence, engaging in unsafe sexual practices, using contaminated needles, or participating in illegal activities to support the addiction. These behaviors often escalate over time as the individual